I'm Dr. Connie Corley, and today on Experience Talks, we address some common challenges in the realm of mental health, fear and anxiety, and also concerns and ways to help those who have emotional challenges. Our wisdom experts on the show are two physicians, Dr. Friedemann Schaub and Dr. Mark Komrad, whose books we'll be discussing, and they guide us on paths to wellness. This is Dr. Connie Corley, and we welcome to Experience Talks today Dr. Mark Komrad, a psychiatrist in Baltimore, Maryland, and author of You Need Help, a step-by-step plan to convince a loved one to get counseling, published by Hazelden. For 25 years, Dr. Komrad has treated thousands of patients and advised people on how to convince an emotionally or behaviorally troubled loved one to accept psychiatric evaluation and treatment. He has worked in both outpatient and inpatient settings and has had extensive experience with the process of involuntary treatment of patients in emergency rooms and hospitals. Among his many accomplishments, Dr. Komrad is a distinguished fellow of the American Psychiatric Association and has been a consultant on motion pictures and even portrayed a psychiatrist on film as part of his commitment to promote a more accurate view of mental health professionals in the media. Dr. Komrad, welcome to KPFK.
Thanks so much. It's a delight to be joining you.
Thank you, all the way from Baltimore. Tell us, how did the idea come about for writing You Need Help?
Well, it originally started with a radio show. I had a coast-to-coast radio show around the country called Komrad on Call, kind of a Frasier thing where people would call in to consult the psychiatrist. And probably the single most common question I got asked was something like, my brother or my mother or my good friend or my kid is clearly troubled and troubled beyond my capacity to know how to help them. How in the world do I begin to talk to them about getting some professional help? And my answering that question in 100 different ways over the course of that radio experience was the birth of this book. And then I really developed a specialty in my own practice of psychiatry where families would come to consult me and brainstorm about how to get a troubled loved one, a troubled relative, to accept professional help to get them in the door.
So this is coming from a lot of experience, not only working with your own clients, but people coming to you because they hear about your expertise.
Very much. You know, Connie, the mental health, the state-of-the-art mental health treatment is so effective, and yet it's so underutilized. Study after study really shows that only about 1 in 3 people who have really very clinically significant behavioral and emotional problems ever end up getting help for it.
Yes.
So, you know, there's a tremendous reluctance to seek treatment, and sometimes the biggest hurdle to overcome is getting people to walk through that door to get that initial professional evaluation. And really, that's the object of my book. Is very, very simple, and that is, through a variety of steps and techniques, how to get to convince somebody to walk through that door and get started, at least with that initial evaluation, to be able to help answer the question, what in the world is going on here, and what can we do about it?
Well, what would happen in a first appointment, let's say with a psychiatrist or sometimes a mental health professional? Because a lot of times what people are afraid of, they say, well, you know, I'm going to go in and they're going to put me on drugs or tell me I'm crazy and so on. What really happens in that first visit?
Well, really, the process really begins, like with any healthcare professional, in going through a very detailed history, both from the person and sometimes from other people, like family members, to try to look at the various symptoms and the way in which they've unfolded over time, and to begin to focus on what the pattern is here, because really, just like the heart or the lungs or the pancreas, the mind, the brain, goes awry only in a very set number of ways that we've come to identify. And, you know, many people have this idea that you shouldn't diagnose a problem in mental life. In point of fact, as Hippocrates said 2,500 years ago, diagnosis is half the cure. Trying to answer the question, what's going on here, is very, very key, and that really is what starts in the initial evaluation. And then from there, once we can figure that out, we can know what of many different options there are to begin treatment. Treatment may consist of various forms of talk therapy, either individually, with family member involved, or with groups. It may involve medication sometimes, sometimes not. You know, when you take your kid to the doctor's office with a sore throat, it's not that unusual to come away saying, you know, no prescription is needed. and we psychiatrists, have that same option as well. And then there are other levels of treatment for more serious cases that may involve more intensive programs, including hospitalization, which is pretty rare, as a matter of fact. But those are all the things that go on in the course of that initial evaluation.
I wanted to come back to something that I was reading recently in a publication by the American Psychological Association. And I read that just 30 years ago, it was believed that the onset of clinical depression, which is the number one cause of disability worldwide, could not be prevented. So, Dr. Komrad, what has changed since that time, only 30 years ago, in terms of prevention and treatment of mental illness? What kind of hope do we have now that things have improved?
Well, there are two different kinds of prevention. One, which is preventing the problems from occurring in the first place. And the second is, once the problems have begun, how to minimize them so that they don't ravage a person's life more than they need to. And I think we can talk about each of those. Right now we don't have time to talk about both, so I'd want to focus on minimizing the development of illnesses, because study after study has shown the sooner you can get involved and bring a state-of-the-art treatment to any one of these, a number of mental disorders, the more you can spare people the development of the kinds of problems that mental disorders cause, from, problems in relationships, divorce, alienation with children, through difficulty in school and inability to work or, achieve your potential in work. There's so much of that can be really prevented and minimized with early intervention. And unfortunately, because people are so reluctant to get into treatment, and my book actually addresses some of the most common reasons for you to understand about why people don't show up for treatment. But unfortunately, when they do show up, more often than not, it's kind of late in the game after problems have really evolved. And this book is trying to help folks get their loved ones in as early as possible with the various techniques that I offer.
Well, let's talk about that a little bit. You have this wonderful book. It's so clearly written and very compelling. You Need Help, a step-by-step plan to convince a loved one to get counseling. I know we don't have time to go through all 7 steps, but what can readers expect to find in your book? And tell us about the website, too, so if they want to look it up before they order it.
The website is very simple. It's youneedhelpbook.com, youneedhelpbook.com. And the book really takes you through a variety of steps, beginning with picking the right time and place to begin to address this, and how to engage in the most encouraging and facilitative conversations in which you can really get to yes. However, that may not necessarily always be successful, so we go on from there, if necessary, about how to mobilize some allies to help you in your quest to get the loved one in the door of some professional mental health treatment. Allies such as primary care physicians, clergy, important family members, coaches, and so forth can be very, very valuable. And then, if that is not effective enough, the book goes on. Really, the core of the book is helping people tap the often underused power of relationships, particularly family relationships, and to begin to steer people towards treatment through the use of the relationship, sometimes in families involving privileges and consequences, an approach that I call therapeutic coercion or caring coercion, that is actually quite powerful if you need to do that. And then finally, in the most extreme situations where there is danger afoot, danger to self or danger to others, we have, fortunately, in this country, a system for involuntary treatment, involuntary, at least an involuntary evaluation, hopefully followed by treatment. And I really teach the reader about how that's done and how to mobilize that system, and most importantly, how to work that system in order to get the most optimal outcomes from it.
Great. I know when we talked before the show, you shared a success story with me, and maybe you could tell our listeners in a minute or two that we have left to wrap up our short but very informative discussion here. Can you just share an example?
Sure. The example that I had given you was about a man who was really depressed, and his wife was really trying to work on getting him in to see a mental health professional, psychiatrist. And he kept refusing, but it came time for their anniversary. And I coached her. She was my patient, as a matter of fact, and I coached her to say, and she did, listen, there's something I really want for my anniversary, something more precious than anything you can find in a store, something more precious than rubies and diamonds. I want the gift of you getting an evaluation for how you've been feeling. That would mean more to me than anything else. And it worked. The next day he had called to make the appointment.
That's fabulous. So I want to thank you, Dr. Mark Komrad, author of You Need Help, a step-by-step plan to convince a loved one to get counseling. It's been great having you on the show.
Thank you for the privilege.
And we don't